Hospital pharmacy is healthcare service which comprise art practice profession of choosing, preparing, storing and dispensing medicines and medical devices. The main functions of hospital pharmacy to provide the specifications for purchase of drugs, chemicals, biologicals, etc. Manufacturing and distribution of medicaments, dispensing, sterilizing parenteral preparations, dispensing of drugs, management of store, establishment and maintenance of drug information center, providing cooperation in teaching and research program, discarding the expired drugs and containers. Hospital pharmacy and its organization structure. Pharmacy manager identifies a relatively standard organization design that most closely to the pharmacy needs. The design is modeled to match with unique requirement of the pharmacy and hospital administrator. The size and nature of pharmacy department management staff will depend upon the number of personnel in the department and scope of service delivered. Small pharmacies tend to have much simpler organization structure, which is usually understood, and no problems arise in the pharmacy of primary healthcare centers. Large pharmacies with assistant chief pharmacist, supervisors, and professional persons have complex organizational structure. Therefore, authority must be delegated by the chief pharmacist. Location and layout of pharmacy. Here you can see this. Hospital pharmacy is most located in hospital premises and only the patients and staff can easily approach it. In multi-stored building of a hospital, the pharmacy should be preferably located on ground floor, which is especially the dispensing unit. It should be laid in such a way that there is a continuous flow of men and materials. Staff required in the hospital pharmacy. Staff requirement in hospital pharmacy depends upon the strength of patients available in the hospital wards or hospital premises. Based on the strength, up to 50 beds, there is the need of 3 pharmacists. When 100 beds are there in that hospital, they must have 5 pharmacists. 8 pharmacists are required to the hospital which is having 200 beds. Up to 500 beds, there are 10 to 15 pharmacists were needed. Role and responsibilities of hospital pharmacy. Hospital consists various departments that depend upon the specialized service and how large the hospital. All major departments within hospital occupy specialists as per their needs. All departments are led by the experts and they are headed by a higher authority. Hospital and therapeutic committee contain a pharmacist who is important member of hospital and therapeutic committee. A pharmacist usually comes second in command after a physician in the committee. Pharmacists work towards to maximize and minimize and maintain the rational drug use. Dispensing to the OPD or IPD. Before dispensing of drugs, pharmacist must be sure about the current prescription of the drug and validity. With the pharmacist is responsible for the distribution of drugs and within the ward and coordinated with the nurses. Pharmacist also supervises steady supply of drugs as per their needs. OPD or IPD pharmacists work together with the inventory and drug distribution in charge and physicians. Drug distribution. Pharmacist has major role in supervises regarding proper distribution of drug according to the entry pharmacy floor, ward pharmacy, IPD, OPD, etc. To avoid the other failures or ambiguous, a pharmacist also supervises the purchase orders, manages the logs of material and the transfer across the departments, and maintains smooth functioning of the drug distribution across the hospital. Purchasing and inventory control and budget. Hospital pharmacy plays an important role in purchasing drug account. There are varieties of products with similar characters. In such case, pharmacist has to choose the best few from variety of products. Pharmacist has to take balancing and rational decision which consider economy, health and service. Pharmacist has to play a role in budgeting the pharmacy, and the role also includes paperwork and also criteria of jobs. Okay. Pharmacists are officially a part of budgeting committee, and they must skillful economic budget to deliver the service at cheaper possible rates. To plan out a budget strikes balance between the aspects. A vigorous experience and skills are required to balance the quality economy of the drugs. Best brands are generally chosen. Controlled substance procurement and distribution. Hospitals are hospitals occur controlled substance in large volume, thus supervising the unit by pharmacist has crucial. For the procurement of controlled substance, they require complete legal paperwork, and pharmacist is authorized by the law of procurement. Without consent of pharmacist, hospital cannot procure the same. Pharmacist has also responsibility to regulate the use of such substances in hospital premises, because such substances are very like to misuse. Manufacturing and bulk sterile products. Large hospitals manufacture their own bulk drugs to save the cost, and allow the steady supply of commonly used drug. For example, paracetamol, ranitidine, saline solution, dextrose solution, etc. In such hospital, the manufacturing plant or unit is segregated into several departments like manufacturing, packaging, labeling, QA, etc. Pharmacist has to supervise the activities of manufacturing as well as responsibility to control over them. Hospital formulary. Hospital formulary Hospital formulary is a brief and complication of information which related to the drug and guidelines for regulation in hospital. It is similar to pharmacopoeia but intended towards the incorporating better and cheap conditions of the specific drugs in hospital pharmacy. It is generally contain drug information which particularly preferred by hospital pharmacist for the patient. A pharmacist plays an active involved in preparation, updating, reviewing and following a hospital formulary. Investigational drug use. This is based upon the technical expertise. Hospital pharmacists work in phase 1 and phase 2 clinical trials. Drugs used in clinical trials are generally reviewed by the hospital pharmacist and HTC before use. While going to the education and training programs, Majority of hospitals provide the training programs for healthcare practitioners. Such training programs runs under the diverse faculty of physicians, administrators, nurses, pharmacists, etc. In such programs, pharmacist has play a role in training of to fresh or junior pharmacist. They provide the theoretical and practical training to the trainers. When we move to the adverse drug reactions and drug interactions, this is another topic.